Over the last year and a half, our world has been torn apart by the coronavirus pandemic that has attacked our lives of so many. During this pandemic, doctors, nurses, and other healthcare professionals have worked tirelessly towards keeping our world healthy. Over the last couple months, the pandemic numbers have skyrocketed with the presence of the new Delta variant and has affected patients tremendously that were not originally affected in the first couple waves. In this article, doctors from the Knoxville area talk about their plea to patients to get the vaccine so that maybe they will see a decrease in patients. The doctors talk about the children that are becoming extremely ill and how they are having just as worse cases as adults. We Can't Handle It All, Pediatricians Slammed by COVID-19 is an article by Knoxville News Centennial by Vincent Gabriel that sheds light on the intense stress and anxiety that doctors in the area have been dealing with. On July 1st, Knox County saw 10 new cases. On October 31st, the county saw 479 new cases, the largest single-day increase in cases since January 8th, during the previous height of the pandemic. On average, Knox County has seen 392 new cases a day over the past year. There are currently 5,562 active cases in Knox County, the highest number of active cases ever recorded during this pandemic. Here's what it feels like to work in a pediatrician's office right now. Take the normal winter busyness of flu season and combine it with the late summer pushback for back-to-school physicals and add in a whole bunch of anxiety. It's like the world has turned upside down, said Dr. Joseph Gigante, a pediatrician at Monroe Carroll Jr. Children's Hospital at Vanderbilt University. We are seeing outpatient volumes that are typically seen in the wintertime. Gigante said that between July and August, his clinic saw 8,000 kids in their clinic. That means they squeezed in 1,000 more kids than they typically seen in those previous months. The typical rashes, stitches, broken bones, and routine checkups are competing for time with respiratory infections caused by RSV and the Delta variant of COVID-19, which affects children at a higher rate than it did before. Pediatricians in Knoxville saw it coming. Delta moved from west to east, striking Memphis and Nashville, and now here. Dr. Logan Williams of Knoxville Pediatric Associates said that typical summer pattern with a low caseload shifted quickly. Williams reported that roughly 12 to 15% of this practice's patients are positive, which translates to about 5 to 10 kids seen for COVID-19 symptoms every single day. That's the highest positivity rate his clinic has seen over this entire pandemic. Because there are so many people sick with different things, we've been busier than we've been in a while, Williams said. Depending on the time of day you call, sometimes we have no spots to see anyone sick unless it is a true emergency. Doctors say morale among pediatric healthcare workers is low. Scared family members sometimes take out their frustration on nurses and doctors who routinely find themselves having tense conversations about masks, social distancing, and vaccines. I am incredibly frustrated to the point of almost being despondent when I have conversations with adult patients, mainly who make irrational decisions, Green said. It's bizarre, absolutely bizarre. Green's clinic is running at full capacity. He and other staffers have been worked to their limits and are tired of talking about medical conspiracy theories. Green, who treated adults and children, said that he has asked patients to find other doctors after they continually refuse to vaccinate. He likened it to leaving a boyfriend or girlfriend due to irreconcilable differences. It's the breakup talk. We just need to see other people, Green said. You have a right to choose, and I'm in the position to force you to do anything. I'm not in a position to force you to do anything, but vaccination is very important to me, he said. We're sitting on a powder keg, said Green, because flu season has not even occurred in over a year. It's going to spread through schools, he said. With the start of in-person school, the problem has gotten worse. Pediatricians said that they see many cases of COVID-19 among children and teenagers that they believed were contracted at school. These kids end up sick at home by themselves or infect siblings, parents, or other family members. Large practices are even struggling to keep up with more serious cases, and the demand for COVID-19 tests have created a logistical nightmare too. We're getting busier and busier, Lopez said. Right now, we're doing about 10 infusions on children every single day. And it's not even easier with the adults. There's 92% of adult hospital beds occupied in the Knox County. In conclusion, the plea for vaccinations is at an all-time high among most pediatricians, the stress on our healthcare system has got to be relieved before burnout becomes reality.